to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. Now, today's topic we're going to talk about tongue. Okay, tongue diagnose. So, tongue diagnose is a method that we use a lot as a Chinese herbalist, Chinese doctor, or acupuncturist. Think about it. 1,000 years ago, we don't have CT scan, we don't have X-ray, we don't have ultrasound, then we don't have blood test. So how do we actually check the body? We use the tongue, we use the pulse, we use the eyes. So tongue is one of the great methods that we use to. Hi, Glennis, on Facebook. I actually got Facebook and YouTube go through just two cameras in front of me. So now you guys can hear me because I was trying on the stream on a program software. It didn't work well, but I'll try it again next time. I don't have much time today, but I have to finish today's topics. That's great. Thank you. Much better. Now, back to our, so check your tongue. If your tongue is like this, this is tongue on here. So what's the tongue? You can see is a lot of white stuff on top. So what is normal? The normal tongue will be in here. You see, in this tongue, it's in the tip area, on the tip area, and you can see the red color, and that's normal color. So when you look at the tongue, you should be able to see the red color over there. Not too red, just pale red. Okay, it's just red. And if you can't see your tongue, so you want the red part from here to the bottom of your tongue. The whole tongue, you should be able to see it. If you can't see it because of the white stuff on top, too thick, or you can see it, if you can see it but not very clear, and that's a problem. So what is the coating means? This is very thick coating though, and become a bit yellow. If you can see it clearly, it's a bit yellow. So yellow indicate heat. If the white thick on top, it indicates that stomach and spleen are not function properly. Okay, so it developed a lot of coating. So this patient told me that over years, it's been years, that every morning she tried to scratch off, try to take it off, remove it, but it didn't work. Why is that? It's because it's not something that it just put on top. It's not like some dirt on top that you can just scrape it off. No, it's from the inside of your body. It's grow from inside. It indicates the inside is not healthy. What's not healthy? Stomach and spleen. So stomach and spleen, we know we eat food, we drinks, everything that we eat contain fluid, water. And if fluid go to your stomach, it need to absorb, and the rest of it pass it out to your body. Go through the blood and pass it out for bowel motion, and then go to blood and then go to your some of them go to your large intestine, small intestine, and absorbs the water into the blood, and into your kidney and through the bladder and pass it out. Right. So some you need to use it, some you just pass it out, process it. If this function doesn't process properly, then tongue ended up with growing a lot of stuff. That means that you have water retention. That is why when you have water retention, some water retention, you can feel it, you can see it, which you have it. Puffy ankle, swelling ankle. A lot of people have it, swelling legs. Okay. And some have puffy face on the eyes in the morning. Now, this coating, we know it indicates indigestion, it indicates water retention, right? So what kind of symptom would you feel if you have this? Stomach pain, bloating, acid reflux. It can cause loose bowel motion or watery bowel motion, right? Or indigested food in the stove. Okay. And because stomach and spleen control the muscle, so you may feel pain in the muscle. You may feel pain between the joint, or you can feel pain in the lower back, on the calf, or in your neck, or all over your body. You feel, oh, this is muscle ache, muscle. What else? Because of the fluid, it doesn't pass out properly. Then the water, it becomes thicker and it becomes phlegm. We call phlegm, or it becomes mucus. So when it produce in the stomach and spleen, it actually store in your lung. That is why you start feel a lot of people clear the voice all the time, and then, or some people spit out a lot of phlegm, mucus in the morning. So this is all indicate that the mucus, part of mucus, is actually from the stomach and spleen. If you have the tongue, this is how we diagnose it. Okay. What else can you see in this? Yeah, tired, heaviness. You feel heavy, you feel tired. If you have tongue in that, we know this is indicates stomach and spleen problem. And what else? Fatigue, tired, heaviness. I think that's about it. Okay. On gum pain. And as well as when you brush your teeth, you have bleeding from the teeth, from the gum. If you have the coating, and that means that because the bleeding can be from heart function. If you have the tongue coating, a lot of that or thin, and that means that bleeding is causing from the stomach and spleen. Okay. What can we do to eradicate the fluid and phlegms? Very, very good question, Dennis. So to do with that, we know it's a stomach and spleen, right? Let's say if your stomach spleen function should be in here, then you'll be healthy in this level. But now you have all the symptoms, it's because the stomach and spleen function dropped down to here. And you want to build up to here, and it's symptom free, and everything's fine. Then what does stomach and spleen do? Accept the food that you eat every day and break it down. It absorbs it, but it drops the nutrition. So whatever you eat is going to harm your stomach and spleen if you don't eat it well, if you don't eat a clean diet. When I say clean diet, it's plant-based diet. You'll find when you eat plant-based diet, a lot of symptoms will weigh off. A lot of symptoms will be better, and your stomach and spleen function will up. Okay. If your stomach and spleen function are not so bad, and those symptoms are not so bad, and it may up to here just by changing the diet up to where it should be, and that is great. But unfortunately, most of the case, if you suffer all this, when you change your diet to clean diet, you feel better, and the stomach and spleen may just go up. If you can reach to the half, that's even better. But some just reach a little bit. Some, by changing diet, it doesn't actually really help them. It just help you don't get any worse. But you can't bring the stomach and spleen function up. That's why you need us for. So acupuncture and Chinese medicine can quickly bring the stomach and spleen function up. If you just rely on stomach and spleen, if you just rely on acupuncture and Chinese herbs, yes, it can help you, but we always find that it comes to here, and it's very hard to get progress to here. So that is why I actually encourage my patient become plant-based diet, become a vegan, because I see a lot of patients when they do well in a diet, their bowel motion change quickly, and through our herbs, Chinese herbs, and acupuncture, and it went very fast. When it went very fast, the function very fast, and then you'll find, oh, your bowel motion become firmer. You know, it was loose in digestion, it become firmer, and that's a good sign. And your bloating become less and less and less. You know, and your pain in the stomach just about gone, and that's great. And then you check your tongue. Okay, you see the tongue in here, and the tongue become better. This is 3 weeks after. Okay, so this is before treatment. The tongue's before treatment, and 3 weeks after, it became there. And this patient actually feel what? I got the consent from her that I can show you this picture, and she said yes, because she was so happy. She was so happy. For years, she couldn't take any fruit. All right, and stomach pain every day and a lot of bloating. Now, not much pain. And recently she was on antibiotics. It got worse again. But because she keep taking herbs. And then that built up even that antibiotic on that. She got worse a bit because she pulled out the tooth and she need to be on antibiotics. And that's okay. I don't want her to get infection either. It's a prescription, right now. So then what happened? She told me that every time in the past, if you took antibiotics, she's going a lot of bowel motion daily, and that's not good, right? Goodness, you say your Chinese herbs have helped my stomach pain tremendously. Oh, I can't actually. It's an amazing detox. That's great. Thank you. Happy they say, what can we do to balance the heart? The heat. What can we do to balance the heat? What do you mean? Do you want to balance the heat? Because we are not talking about heat today. To balance the heat, what acupuncture point to balance stomach? Oh, stomach and spleen. Okay, stomach. I actually show Goodness how to balance stomach and spleen. And for balance stomach and spleen, I actually show you guys in another video. You just need to acupressure point. You know, just do this. Remember doing this? I show you all this because this is going to clear out, bring the stomach and spleen function better and better. And not just that, they actually all the organs. All right. So for acupuncturists, you can do stomach and spleen using Tai Yin Yang Ming pattern. That's when it comes to global balance, Tai Yin Yang Ming balance. All right. And choose what? Harari point. Or choose Tai Yin Yang Ming, the mother of the meridians. So the one, because if I change the point, it'll be in Chinese. So it doesn't help you because you guys use code. So use the mother's point of the meridians and of Tai Yin Yang Ming, global balance pattern, and it's very good for that. Or just use medical aid to treat this symptom are fantastic for it. Okay, now keep going. So this tongue, so I just show you, I would like to show you again. So within 3 weeks, this tongue improved a lot. Okay. So when after treatment or you change your diet, tongue should get better. And you will see, that's a very common sign for you, okay? And you see what happened in here, in this tongue, it got better. It always got better from here first, from the tip first. It keep going, and then in the root of the tongue, in the bottom of the tongue, it still have thick, because this is the harder part to clear off. And you may see your tongue is all clear in the front. This is my tongue. You see pretty good, right? Okay. And in the bottom, it always have a little bit of dampness. As you can see, I have a little bit in the coating, a very thin one. Okay, so no one's perfect, but if I can get rid of that, that'll be better. Okay, so for you can check your tongue. If you have any coating, that means you have water retention, you have stomach and spleen. problem, then you should keep your diet clean, plant-based. Okay. So, and what happened? If you clean it, if you keep it well, then a lot of symptoms will be better. If it doesn't, that is the time that you should come and see us. We'll get acupuncture and Chinese medicine for you. Okay. Then when acupuncture and Chinese medicine go in, I normally, like, this patient see me once a week for 3 weeks now, and next week will be the fourth week, and as well as acupuncture and Chinese herbs daily. Goodness, the pressure point remedy is also fantastic. Yeah, I'm using the tool you give me every day. Thank you for this knowledge. No problem. I would like to help, and I'm happy that hear that goodness is getting better from the acupressure point. Then, as this case, you know, I always tell my patient, you're not relying on my acupuncture and Chinese herbs. Why is that? Because I show you some home program, the acupressure point. You should do it. If you get it every day, you find that your result will speed up very, very soon. Those patients, they're too busy and they forgot to do it, and they can't do it, and they just, or they don't care about the home program. I'll see if they just want to rely on my acupuncture and Chinese herbs, the progress, you can see the progress, but slow. It always come back all the sudden. I say, do the acupressure point. When you have those symptoms, do the acupuncture and keep it once a day. You know, if you have these conditions, all these conditions for 10 years or 3 or 4 years, and please don't expect within a month or 2 months you're gonna get rid of it and stable. No, right? We're gonna expect more time. That is why I want you to get better sooner. That's why I show you a lot of home program, acupressure point, that you do it every day. I really encourage you, and as well as changing your diet, because this is the best way to go. Not the only way, the best way to go to bring your organ function up. And BMI, I just had a patient who on nickel, I can't say the name right now. It's antidepressant. Okay, so any drugs on your body, it's gonna harm your stomach and spleen. Any drugs. A lot of people on painkiller, you didn't realize that painkiller is harming your tummy, stomach very badly. Very badly. That's why when you're on painkiller for a long time, then you'll find that you have the pain still there, comes and go, and then you end up with more and more symptoms, more and more condition. That's because gradually the painkiller actually helping you cover the pain, but it actually harming your organs, and then you start to get more and more symptoms, like start to get diarrhea, not sleeping well, all these things. So be mindful, all these things, be open mind. I'm here to give you advice, not advice, information. Okay. Information. So this is very important. I hope you guys get it, and I hope you enjoy it. It's been 18 minutes, coming up to 20 minutes now. I'm gonna close this discussion. If you have any question at all, just put it down in here, and I would be able to answer you. I hope, or just PM us, or if you want us to look at your tongue, just take a picture. Take a picture, and then send it to us. Don't post it in here, because this is your privacy. I don't want to exclude your privacy. Okay, just if you want to do it, it's okay too. I would love to answer you all this time. What does it mean? Okay, and even better, that if you want me to look at you, just come in for 15 minutes. It's free assessment. So call us on 0784679956. Okay, so that's it for today. Let's see what you get in this. What about the veins and the bottom of the tongue that you show me might have become clear now? Okay, good question, goodness. The tongue underneath. Okay, my one's pretty clear. Our people have a lot. No one's perfect again, because the environment we live and the medication we've been taking, or what we take, so chemicals in it, what we wear, got chemicals in it, the roundy powder, a lot of stuff, where we work, so our skins, what we eat, we absorb a lot of toxins, and this toxin it can tell from the tongue, and from the tongue we need to clear it all out. It take long time. I'm not saying, when I say long time, it take years. That's why when all my patient, all symptom gone and everything's fine, the organ's good, I say, well, you need to take some herbs, 1 teaspoon or half teaspoon a day, maybe in the morning, some in the night before night. Take it for years. Then after a few years, you'll check at your tongue, you find out, oh, those veins become small and small and smaller. And that's the progress. And how do you pass out all the toxin? It's through your skin, perspire, sweating. It's through your bowel motion. It's through what? Your urine. And some of our patients, they pass it very well. When they take it, they get loose bowel motion, a bit loose, or black bowel motion. That's because toxin helping you pass the toxin. Okay, right. Diet change is very important. Go vegan. Thank you. Free assessment, people go and have it. So that's amazing. Thank you, goodness. Yes, I'm laughing, goodness. All right. Yeah, call us 0784679956. All right, we're happy to help, and send us your picture of your tongue and PM us, and we can have a look and see whether we can see anything. This coating is just one way to look at it. Okay, we have pose. Okay, we look at palm as well. When we have time, we can show you about palm. Okay, when I get to the software, right? Okay, so stay awesome and happy Friday, happy weekend. I'll see you tomorrow. See you then. Bye bye.